Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us on the program. Our guest today is Dr. Michael Ison from the Feinberg School of Medicine at Northwestern University. He's joining us today on the program to talk about the current flu season as well as the latest information in flu prevention and treatment options. Welcome to the program, Doctor. Thanks for taking the time.
Thanks. It's my honor to be here.
Well, give our listeners a bit of background about yourself. I know that you're there at Feinberg at Northwestern. What's your area of expertise, and why are you interested in the flu?
Yeah, I'm a professor in the Department of Medicine and Division of Infectious Disease at Northwestern. I mostly take care of transplant patients clinically. My research focuses on prevent and improve outcomes of flu in adults.
So what makes the flu season?
Yeah, I think the real answer to that is we don't know what brings the flu to the community at a particular time. You know that influenza does typically occur seasonally, typically in November. There's regional differences, so the flu may start in Florida and spread across the country, or it may be higher in one area than the other.
Now, the current flu season, it's being called one of the most severe in recent memory. Is that a fact? Is it media hype, or is it something that we should be concerned about no matter what time of year?
So the flu is something to be worried about every single year when it circulates. It can increase the likelihood of people getting admitted to the hospital, increase the likelihood of having pneumonia, and definitely increase the number of clinic visits that patients have. Last flu season was the worst flu season that we've had in recent memory. This flu season is definitely an important flu season, although not nearly as bad as it was last year. This year it's mostly an H1N1 virus. The vaccine is a much better match this year with the circulating strains of influenza than it was last year.
So are there some best practices to prepare for the flu season? What about prevention?
Yeah. The most important thing that people can do to prevent getting the flu is get their flu shot. Flu shot is safe and generally very effective against people getting sick with the flu. It's not too late to get the flu, even though it's in January now. The flu shot protects you throughout the entire flu season, and if you haven't gotten the flu shot, now is the perfect time to go in and get one.
Are there different strengths, for lack of a better term, when it comes to flu vaccines? Are they all the same across the board? Do they differ depending on what strain is breaking out where? Yeah.
So the flu vaccine is reformulated every single year because the flu virus mutates slowly from season to season, and so those new viruses are selected to try to match what's changed in the circulating strains. There are a number of different types of flu vaccines. Most are injectable vaccines. There are some vaccines that are either high dose or adjuvanted vaccines that are predominantly indicated for people that are older, typically above 50 or 65 years of age. But in general, a flu shot of any kind is better than no flu shot at all.
Now, does that apply no matter what a person's medical condition is?
Currently, it's recommended that everyone that's 6 months of age or older get the flu shot every single year. People that have had Guillain-Barré directly attributable to the flu vaccine or people that have very severe egg allergies should consider not getting the flu shot. But other than that, patients should get the flu shot. And if you have a mild allergy to eggs, that's something that can be overcome. And even nowadays, there's some special flu vaccines for people that have egg allergies that can be used.
GenenTech has developed a new flu drug.
So it's an honor to be working with GenenTech to help people understand the importance of flu and some of the new therapies that we have that has been approved for the treatment of patients that have acute uncomplicated influenza. The drug is very effective, reducing the duration of symptoms by about and is a new therapy that patients can use in addition to some of the older drugs that we have to treat the influenza.
Many folks would you say are affected by the flu every year, even with the flu vaccine?
Yeah. So there are millions of individuals that get sick with the flu every year. There are about 250,000 individuals that get sick enough to require hospitalization on average, and about 20,000 individuals that die from influenza every year. Last year was one of the worst years, where we had almost 1 million people hospitalized, where we had 80,000 deaths from influenza. So I think a lot of times people think flu is nothing serious, but in fact, it can make you very, very sick and even kill you.
So we expect brand new influenza treatments each and every year because of this mutation that you mentioned earlier in our conversation. Is that something that we should expect, or are we working toward cure-all, one shot fits all, and don't have is there any way, I guess, to stop the mutation?
Yeah. Well, so there really isn't a way to prevent the flu from mutating. It's actually doing what it's designed to do. It's basically, we develop antibodies because we get sick or get the flu shot, and so the way that it survives by mutating so that it can infect new people, new seasons, will be something that will continue forever. There are a lot of efforts to develop what are called universal flu vaccines that would overcome the changes that occur, so it would be directed at parts of the virus that don't vary. The big question that you were asking about new drugs, would love it if there were new drugs every single year, but as we both know, it's really challenging to develop new drugs for any indication, and flu is no exception. There are other drugs that are undergoing evaluation, but currently Xofluza is the only new drug that we actually mentioned as one of the older drugs that we've had to treat this.
Give us a website where we can learn some more.
Sure. People who want to learn more about this drug can go to Xofluza.com, Xofluza.com.
Thanks. Thanks for joining us on the program. It's been a pleasure.
Wonderful. Thank you very much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.